I'm going to show you two other bite references, because in order to take the handle and our mandibular positioning simulator out of this bite before we send it to the lab, this is what it looks like when we have removed the simulator and the handle. But we have a gap up here, and even though we have visually confirmed before we put this into her mouth with the paste, and then by looking at the piece of paste that was on here when it came out, that she's on the midline, if you want to provide the lab with a midline, then you can fit the posterior part of this between the teeth, add a little up front, put this back in the mouth, and so in this case when Teresa bites into this, she's going to get a complete bite around the whole arch. So it will show up on both sides. In summary and conclusion, I'd like to review those things that can make your practice easier with this system. First of all, it simplifies and shortens the diagnostic process. It also educates patients about their problem and how you can help them. It is a very staff-friendly system. It interfaces with any oral device, and it measures with patient subjective feedback or with pharyngometry. You avoid guessing and approximating. Repeatable at any time. You can go back if you want to redo something. It's going to be there, and the positions replaced between the teeth will give you the identical position. And finally, if you will just take a half an hour, sit down and play with this system as though you're the patient, you will quickly see how it can enhance your practice, and you will soon evolve your own protocol. Encourage your staff to do the same. They will enjoy this process as mine have. So thank you and enjoy. Teresa and I are back to talk about pharyngometry and some comments about the subjective feedback. And you recall in the clinical application, we began with the snore screener, and it showed that Teresa's airway was more responsive to a vertical position rather than the horizontal. And then we used that to select the mandibular positioning simulators to do some other positions, and let me summarize those for you, because we started with an end-to-end 6 vertical, and on a scale of 1 to 5, where 3 is her natural airway, below 3 is of course less, and above 3 is an improvement. And at E6 she got a 4, and it was comfortable. At 2-6 she got a 5, and that was comfortable. At 3-6, her airway was a 5 and less comfortable. At 4-6, it went to a 4 again, and also was less comfortable. And you'll notice that that's farther anterior. And then we went to a simulator that positioned her at 2 and 8 vertical, and she rated that as a 5+, as well as being extremely comfortable. And then we went to a 3-8, and she liked that, and that was also comfortable. And finally we tested with end-to-end 8, and that was not only a 5, but it was extremely comfortable. So what we have selected are 3 mandibular position simulators that we're going to use here in a couple of moments to run through those and see what we get from the data standpoint. And so, Teresa, as you recall, when I hand you this, the number that is going to position your jaw, which happens to be a 2, is facing toward you. So when you're in the upper first notch, you're 2 millimeters forward. And go ahead and just position that. Okay, and would you just pinch your nose, please? And here we go. Okay. Now we're going to try a 2/8. Here we go again. First notch on the top, 2 is facing you. We're in the third scan position. And here we go. Okay. And if you go up to the right column, you're going to see the differences between the, and I'm going to go over and pick up number 1, and we're going to compare that with number 2 first. And you'll notice that the difference between the green and the that sort of purple, if we move over to the column again, then you're going to see when you can compare both the minimum and the maximum. Now we have the green baseline that we're going to compare with that number 2 scan when she was in a 2/6 position. And if we move over to the right column, we're going to see both the minimum and the volume. And you'll notice that the minimum has gone from the 1.68 up to about 1.79, which is a significant increase. And on the volume, you can see the difference between the green and the purple up there. So now if we could move on to scan 3, now we're going to be looking at the difference on the 2/8. She's in the same horizontal position, 2 millimeters forward. She's 2 millimeters wider now. And if we move over to the right vertical column, we're going to see that we have a significant improvement there of about 16.5%, and up above we have a 26+% increase. So now let's proceed on to the 4th scan, and in this case we're going to use the second or the middle notch so that she'll be end to end and 8 millimeters open. So go ahead, Teresa. Okay, here we go. Okay, now let's compare that with the green of the first scan again. And you'll see that now those numbers have changed. We've got a significant increase on both the minimum and also on the volume. So now we can select any one of those positions as our target position, because we know they all produce a respectable increase in the airway and they're also comfortable. So the next in this process would be to select the starting position, which would be the bite registration. And I think in Teresa's case, because we're basically at end to end or 2 millimeters anterior, that it would be very comfortable for her to start with an end to end 6 millimeter simulator that we would attach the handles and the bite forks on and proceed to get our starting position for the titration process. Now let's review what we have just done here with the simulators. We did 3 of these based on what we found from the subjective feedback. And let me say that some of you Sharpies watching this will have picked up on the fact that the numbers on the saved screens that we have been testing are not what we have been testing with. In other words, the positions are different, and that's simply because we have to do the saving after we've done the tests. And so very shortly hereafter what I've got to say, there will be a single screen that will reflect what we've done today so that you can look over that and those different positions and see what the differences were visually. But in any case, to just review those positions, the 2-6 position gained what I would call just a bare minimum of an improvement. Both the 2-8 and the E8 were good and all were comfortable. And I selected the E6 for the starting position for 2 reasons. First, her overjet is 2 millimeters, so when she's in end-to-end, that's a very comfortable position. And secondly, I prefer to take a shorter vertical when I'm starting because I like the option to add to the pads rather than have to grind off. And when we get to the end of the adjustment process, we will use the vertical titration keys to test some alternative verticals increase. And if we find any of those are going to do a better job, then we can quickly take a byte registration using the selected titration key, and the pad addition will be processed the same way as the original pliant, so you can't even tell the difference and it's more durable. So I appreciate your attention. It has been a pleasure speaking to you today, and I hope that this system can do as much for your practice as it has for mine. Thank you.